Low testosterone levels are often overlooked, but there are a wide range of benefits of supplementation. Joining me now is Dr. Russell Bartels from Vitality Bioidentical Hormones. It's good to see you, Dr. Bartels. Thanks for joining us.
Good to see you again.
So last time you talked about the different kind of hormones that we
last time I was here was about 2 months ago, and we talked about the benefits of bioidentical natural hormones.
Sure.
And today I want to kind of talk more specifically about testosterone, natural testosterone, and the benefits that that has. Now, as an OBGYN, I'm seeing patients day in, day out, and they come in, and part of seeing a patient is reviewing their medications. And sometimes I'm amazed at how many medications patients are on and for all these different conditions. And medications for diabetes, for arthritis, for lupus, for hypertension, cholesterol, all these different medications for these different conditions. And these medications do improve people's lives, but they sometimes only mask the symptoms and aren't really getting at the underlying source of the problem.
Sure.
And so if I told you that there was one medication, in the form of a bioidentical hormone, testosterone, that could reduce the need or replace the need for a lot of these medications and actually treat the underlying cause, I think that would be pretty impressive.
Yeah, absolutely.
And so testosterone has a lot of properties, and if we can put up the slide for the benefits of testosterone, you'd be blown away at how powerful this one hormone can be. Just to run off a few: increased bone density, relieving anxiety, depression, increasing muscle mass, decreasing fatty tissue, but also reducing the need for insulin in patients with diabetes, in patients with arthritis, getting rid of their aches and pains. It's a very powerful hormone.
Do you think a lot of women, when they hear testosterone, they think, oh no, I don't want that, I don't want to be Arnold Schwarzenegger? I mean, is that the old mindset?
Initially the testosterone for the women, what are you talking about? Isn't testosterone a male hormone? But I say, hey, you know what? Women, estrogen and testosterone. It's just estrogen is more predominant or a higher level than the testosterone. And men are surprised to hear that they have estrogen as well. It's just in a reverse ratio.
Do women start to lose their testosterone at a younger age? Is that what happens? Or?
Not necessarily. I mean, testosterone levels can begin to diminish in as early as the 30s, but 40s, and then 50s, 60s, they just really drop off, especially for men. And so it's been interesting as a OBGYN to be treating men, and it's been quite rewarding because my female patients, they come in, we get them tuned up with the hormones, they're feeling great. And actually just this morning I just came from seeing a husband and wife team, couple who I treated the woman about a month ago. Her estrogen level and testosterone levels were basically undetectable. She's feeling great on estradiol and testosterone bioidentical pellets, and she brought her husband in. And so that's going back a while. That's how men came into the practice.
I gotcha.
And the men are, seeing their primary care physicians and being told that their testosterone levels are normal, when in fact they're in the normal range, but we want to get them higher than that.
So how do you know if maybe this is what is happening? What are some of the signs?
Gotcha. Signs and symptoms of testosterone deficiency can be many, and sometimes it's just, hey, I don't feel the way I used to. I'm not playing sports as well. I'm not getting the results in the gym. My sex drive is just, I don't even care about it anymore. This is for men and women, and for men it can improve erectile functioning. They don't need the Viagra, the Cialis anymore. It's just, it might just be as simple as I can't get off the couch after dinner.
Wow.
I'm tired. I'm not doing well at work. It's just, I'm not right, doc.
And some people, do they write it off to, well, I'm getting older, I guess it's just part of the whole aging thing.
This is how it goes. And it's not how it goes.
It doesn't have to be like that. It
doesn't have to be. And it's just been really exciting to see how people, their lives are just changing, and they're just feeling so much happier. Yeah, I mean, patients, the woman I saw today, she's like, how many cards I handed out today? I feel so great. Everyone wants to know why I'm feeling great.
Are they weaning off those other, you said sometimes they'll come in with all these, do they find that they no longer need a lot of those?
And, I'm finding a lot of support for this, for what I just mentioned about diabetes and arthritis and all these other conditions. But first I was just hearing it from my patients, and then I actually went out and looked for the support in the literature, and it's there. Patients say, you know what, my aches and pains are better. You know what, my insulin requirements are going down. I'm not going to say that everybody can get off their medications. I mean, medications do good things, but I think there needs to be a balance. And if we can get to the underlying problems and, alleviate the need for some of these medications, the patients aren't going to have to pay for these medications, okay?
Right.
And, I mean, lists of 5, 10 medications a patient's on, I can't imagine.
Well, if they're feeling better, too, if they have more energy, which I think was one of your signs,
Absolutely.
lack of energy, then all of a sudden they can do more and
Absolutely.
they're exercising.
They're sleeping
and all,
better,
it
have
kind
more
of goes
energy.
down the
It
line.
all goes, I mean, when you're feeling good,
Right.
you know, you're getting the rest,
Sure.
you're sleeping, you have more energy, you can exercise, sex drive goes up. I mean, everything just seems to
Then
fall
everyone's
in line.
happier.
Everybody's happy.
Now, you have a consultation, kind of an offer for folks
Oh,
if they
absolutely.
want to go in.
I want people to feel better,
Okay.
and I want people to, you know, not have a barrier to coming in and seeing me. So, complimentary consultation. We'll usually talk about the symptoms, draw some blood work, and go from there. And actually, with the pellet form of testosterone supplementation, you only need to be dosed 3 or 4 times a year instead of popping pills all day long. 3 or 4 times a year, you come into the office, we put the medication
Less
in
mess.
painlessly. It's easy, and results start to kick in within a few days to a few weeks. Everybody's a little bit different, but it's just been very exciting. It's good to make people feel good.
I'm sure it's very rewarding,
It is.
especially when people can get off medication too.
It
Thank you,
is.
Dr. Bartels. Very
My
good
pleasure.
information. So if you do want more about Vitality Bioidentical Hormones, you can go to ScottsdaleBioidenticalDoctor.com. There is the phone number right there on your screen.